Welcome to the Rremototron control system, the intelligent operating core behind every Ormedico rehabilitation device. When the super admin logs in, the dashboard immediately presents a live overview: patients assigned, therapist connected, active devices, and weekly performance metrics. From here, we begin by selecting the Equipment tab. Every device in your clinic, franchise, or home care fleet appears here by its serial number: knee mobilizer, shoulder mobilizer, back mobilizer. We'll open the knee mobilizer labeled KM00001. Inside the device profile, we see key identifiers: production date, sale date, and whether the unit is configured for the left or right leg. Everything flows from the Admin Program panel. This is the control center where the clinician programs the therapy parameters before the patient begins. Here, the therapist sets the device behavior, motion speed, the number of automatic cycles, pause durations, progression adjustments, and contract relax settings. The idea is simple: build a safe, custom protocol once, and the patient's device performs it perfectly every time. Next, we set the progressive stop limits. These define the maximum flexion and extension angles the device will allow during therapy. In this example, flexion is set to 61 degrees, and extension is limited to -10 degrees. Force limits add a second layer of safety, protecting the joint from overload. If the patient reaches their comfort limit, the actuator slows or reverses automatically. Now we enable the therapy modes the clinician wants the patient to run: autoflex, progressive rehab, and contract relax therapy. Rremototron ensures patients only access the modes assigned by their therapist. The next step is defining the start position. This captures the exact joint angle where each therapy cycle begins. The therapist uses the manual flex and extend buttons to position the limb, then saves the starting angle into the patient's program. Rremototron also includes a motion sequence builder. Up to 10 individual movements can be programmed in a single routine. Each step defines whether the actuator flexes or extends and the precise angle target for that movement. Sequences can alternate flexion and extension, progressively deepen the stretch, or follow highly specific clinical protocols. The therapist may also repeat or reverse the entire sequence, particularly valuable for the shoulder mobilizer, where multiple actuators coordinate across different planes. With one tap, the therapist saves the sequence. The device now has a structured motion plan the patient can run immediately. In addition to passive and guided range of motion therapy, Rremototron includes a built-in strengthening system with 3 powerful modes: isometric, concentric, and eccentric. In isometric training, the patient alternates between relax and contract. The app tells the patient exactly what to do. When the device is moving between stop positions, the patient is instructed to relax. When the actuator reaches its programmed pause point, the screen switches to contract, and the patient pushes against the device in a controlled hold. In concentric mode, the patient contracts in the same direction the device is moving, trying to increase the device's speed. This provides safe motor-assisted strengthening with real-time force monitoring. In eccentric mode, the patient resists the device as it moves. If the device flexes, the patient extends against the motion. If the device extends, the patient flexes to control the resistance. This controlled resistance builds strength while protecting the joint with force limit safeguards. With Rremototron, every movement is intentional, every limit protected, and every session automatically logged. This system delivers precise, programmable, measurable rehabilitation and brings clinic-level control directly into the patient's home. This is Rremototron, precision rehabilitation, remotely programmed, intelligently monitored.